Yeah, I think this cancer is a pretty tricky topic because we don't really even like without micro nanoplastics, it's a pretty like we don't really understand it very well, and they do
Yeah,
complicate things with micro nanoplastics, and people are finding, oh, by the way, there's more micro nanoplastics in like tumors or
yeah,
atherosclerosis, in
yeah.
plaques. Like, oh, like what's going on? Like, it's very hard to link because we don't even understand the whole like this diseases. So like I guess it's a very difficult topic to like uncover since we don't even know very well, even without micro nanoplastics. So, right, you're a radiation oncologist, and obviously you've spent many, many years thinking about how these, various external agents, including microplastics, interact with different biomolecules like DNA, proteins, cells, and tissues. So, now knowing a little bit about micro nanoplastics, how did it change the way you think about the cancer biology or cancer risks?
Yeah, no, again, great questions. As a radiation oncology physician that treats cancer every day, there are a few plausible mechanisms by which micro or nanoplastics could actually influence the cancer treatment I give regularly. But I want to emphasize that the word here is emphasis is plausible because this is an emerging area and we just simply need more direct and better quality clinical data. However, there's a lot of concerning possibilities. For example, one possibility relates to the tumor cancer microenvironment. Now, the radiation response when we treat with radiation therapy is influenced by factors like oxygenation, baseline inflammation, vascular function, and immune activation. If chronic exposure to any of these particles contributes to systemic inflammation or alters immune signaling, it certainly could, in theory, shift how cancers and normal tissues respond to radiation therapy and actually other cancer treatment modalities such as chemotherapy and immunotherapy. Now, a second concerning possibility is the interaction with normal tissue and toxicity resulting from that. Now, in radiation oncology, we think a lot about fibrosis, vascular energy, and inflammatory cascades. These can unfold over months, even years after treatment. And if a patient has an additional inflammatory burden from any source, it can potentially affect recovery from treatment, symptom severity, resilience. It can contribute to complications. It's not that microplastics would change the physics of radiation therapy treatments, but they could certainly influence the biology of how tissues heal after treatment. And then finally, a third angle is pharmacology. Now, some nanoparticles are intentionally used, interestingly, already in medicine to deliver drugs. But unintended particles in the body, as environmental exposure is, that could potentially bind, transport, or concentrate chemicals in a way that we just don't yet fully understand. So whether that meaningfully affects treatment, efficacy, we don't really know that, but it is absolutely a question that we need to continue studying and investigating. And frankly, to me, it's worrisome. But practically, what it changes for me right now is awareness and counseling. Patients ask what they can do. Now, I'm careful not to overstate what the science has proven, but I do think it is reasonable to encourage low risk exposure reduction steps.